start the recording anyway, and that's good. And then I'll share my screen with everyone, and you should be able to see the first slide in the presentation right now.
Yes, we do.
Okay, so the electronic death registration and notification is the title of this project, and as I introduce myself, I'm acting as the communications and change control manager for this project, and Funda is the project manager, and we're both from ITSS. And our role is to assist the Justice and Public Safety Division to get this system and see that it's properly installed and working. And more importantly, it serves the purpose of the stakeholder groups, which you represent. So the overview of the project is that it is a collaborative project. It's done in collaboration with the Public Safety and the Director General and Integrity Services Branch, Service Canada. And this is all through a letter of agreement for the technical design, execution, implementation of Phase 2, which is the electronic death registry system. And this was developed as per the blueprint that's being followed by most Canadian provinces across Canada. And we are just one and territories, I should say. We are just one of the many provinces and territories that are working along in getting this project going. What the blueprint is then is a model to improve the timeliness, accuracy of the death information received by Service Canada, the Canada Revenue Agency, and Statistics Canada from the province's vital stats offices. So in PEI, we're going to implement this EDR system, and hopefully it will simplify the process, and it will make the process much more timely, and it will reach out to not only the internal medical informants that we have in the group here, but also externally to funeral homes and funeral home directors, so that they can share in the death notification system as well. So the full implementation then will hopefully do that. It will increase the timeliness of the data transmission from the province to Service Canada and to other partners as well, Stats Canada and CRA. And this is very important, not only for the sake of timely data, but for the sake of the family that's involved as well. So this all goes to really serve the public in a better way and a more consistent way across Canada. So as we have been referring to you today, stakeholders, you represent maybe one or possibly two of these groups. If you see your role in medical informant, coroner, funeral directors, or vital stats, the medical informant group is a very wide group. It's really anybody working in the health and medical field in this province that has anything to do with reporting of a death into the Vital Statistics Office. So we have quite a collection of roles that are included, and we'll just call them MIs as we go through the slides. We also have the coroner group, who is also an MI, but acts as a different role in death notification is the coroner. And then we have the funeral directors across the province that couldn't be with us today. And we also have the Vital Statistics Office for the province, and representative today is Joanne Larson. So some of the high-level goals and objectives of this project then is to improve the timeline and the completion of death registration. So what we mean by that is if we are able to electronically enter the data, and it's a shared responsibility by the external stakeholders through a web interface that will hopefully enable the Vital Stats Office to notify the federal partners of 90% of the deaths within 15 calendar days. So that is goal number one, timeliness. Goal number two is the registration efficiencies by integrating with the patient demographic information that we already have. And so if we already have the data, then we might as well use the data. And so in technical terms, and excuse me for the acronyms today, but I will explain them as we go through them. Our first one is the application program interface, which is basically a fancy word for a connection to the necessary DCID information, which is contained in our hospital admission systems and in our client registry and various places that we interact with the public. And so we aim to use and reuse data where we can and where it makes sense. The most accurate information is being captured and stored centrally within the Vital Statistics Office, which is our most up-to-date record of the individual. Goal number three is to improve the accuracy and clarity of information on the medical cause of death via electronic application, also improving timeliness for registering the event, coding the cause of death, and notifying eligible stakeholders of the death. So to support this goal, we have several objectives, and we aim to do this through providing a drop-down list of cause of death choices, assisting the medical informants to efficiently complete the medical cause of death. And so as we move away from paper, we're trying to make the electronic completion of the form itself as easy as possible, knowing that there's quite a few opportunities to make the process less arduous, if you will, and implement the features of technology where we can. So it's hopefully that we'll be able to remove the delay that paper and mailing that come into play, and when we have paper as we do now, and we'll be able to electronically notify whether it's pending, completed, reassigned. Yeah, and that can be the medical cause of death and or the statement of death among specified recipients, which would be medical informants, funeral directors, or the VSO. The funeral director will be able to capture the social insurance number when possible as part of the statement of death, and the VSO will continue to send the social insurance numbers to the Service Canada. The medical cause of death will be transmitted to Stats Canada electronically via our national routing system, which is already in place and which we already use for this purpose. But this system then will electronically interface with that national routing system. And so in that, we'll also capture some information for Stats Canada regarding the cause of death codes, and these will be maintained by our Vital Statistics Office and their database that they have. So looking at the business process then, and how we're going to accomplish all those goals and objectives, it breaks down into to really 8 key steps as we see here. The death occurs, number 1, the medical informant. Number 2, electronically fills out the required registration of death information and flags it as ready for the funeral home, funeral director to pick up the body. Number 3, the funeral director receives the registration of death electronically and plans for pickup once they are notified. Number 4, the funeral director electronically fills out the remaining needed registration of death information with the aid of an informant, which could be a family member of the deceased. Number 5, the funeral director can issue a burial permit at this time if the body is being cremated or shipping of the remains is requested. Number 6, the funeral director electronically completes the registration of death information and submits the record to the Vital Statistics Office for processing. The VSO receives the registration of death and burial permit and validates that all information is complete and accurate and flags that record as complete. Registration is then complete. Now, that is high level. There's a lot of little steps that go on in each one of those, but basically that is the process as we envision it happening, and it's all done electronically. Each of the stakeholder groups will have a tab on the screen to complete their part. Once their part is complete, there'll be an electronic notification sent to the next party to complete their section, and so on and so forth, until it arrives at the VSO. So looking at some of the details that support that, then, from the medical informant and coroner point of view, they access the system, enter the death registration information. They will have a user ID to access the interface and start the entry for the death registration. That'll require a search for the patient, the deceased information, and pulls that information into the system. Once connected to the system, the user enters the search criteria, probably by PHN or date of birth, and search for the patient/deceased. Once the correct record is located, the user selects the record and is prompted to verify the address. So the PHN search is considered best practice. If not available, we will look for the first name, last name, date of birth combination. We'll verify the residence with the mailing address, and any updates to the address could be done right in the system at that time. With the medical director and coroner, we'll complete the entering all the needed information. So they'll proceed to collect the remaining information pertaining to the patient deceased and save the information. This could be assigned to a personnel to complete the registration. Depending on the person who created the registration of death, this person may not have the authority to sign the death, however. So the record can be assigned to an authorized person for signature. So it could be a combination of people filling out the form. The form is going to look pretty well the same as it does now on paper, but it will be on the screen. But there will be authorized persons that can sign it for sure, and that process is not going to change. Yeah, the only thing that will change is it's going to be an electronic signature. Successfully save the record, prints the entered information and places it in the patient or deceased chart, and changes the status so that the record can be edited by the funeral home personnel, and selects the home from the drop-down menu. So once this status is changed, indicating they are done with the record, they select the funeral home. The funeral home then gets the notification through this system that medical cause of death has been entered, and it's now up to them to spring into action and to start their process. The medical informant and coroners also, as part of this process, then enters the registration of death information and assigns the person to authorize the signature. And the coroner may assign other personnel to complete entering the registration of death on their side as well. But in all cases, their sign-off is required either by the medical informant or coroner, which could in fact be the same person. The coroner then authorizes or denies the cremation if they get a request from a funeral director for the cremation or shipping of remains through the system, and the requester is notified. So that process is not changing either. It is simply moving to an electronic request, and it is up to the coroner then to allow or deny that request. The funeral director then receives the notification, as we said a few slides back. They are notified through the system. They do their pickup. They access the system, this new EDR system with a user ID, and they start the entry on their side. And this is the request for cremation or shipping that we saw in the previous slide. And again, it can come back as yes or no. It's up to the coroner what they have decided that they want to do, and the funeral home then is entering the details of registration of death, and they proceed to collect any information that they can that may be provided by the family of the deceased. The funeral director then issues a burial permit. The request for burial is made by the funeral director, and permit number is provised or issued, and then that's handled by the Vital Statistics Division. The burial takes place. The body is cremated or buried, and all cases in cremation, there remains buried. A request to bury the remains may be received at a later date, so it may not happen right away. The funeral director then would successfully save the record, prints the needed information for their file, changes the status so that the record can be accessed and edited by VSO personnel. So the last step then really for any of the stakeholders then is to say, as far as my part, I'm done, and then notification will be sent to the next stakeholder in line, which is this case the Vital Statistics Office personnel. So they know that the funeral director has completed their part, and they can be assured that all the steps have been followed up to that point. Now, at any point in time, the Vital Statistics Office also has a global view of where this registration is at any point in time. So they don't start, the VSO doesn't start seeing this process now. They have seen it all along if they want to, and they can see if there's any lags in the system. Is there anybody ignoring the notifications along the way? And if so, they can intervene and, for example, prompt the funeral director to action the notification if they're lagging behind on any of this process, because the stakeholder groups, medical informants, and funeral directors, coroners will all receive notifications. They can choose to ignore them, but if they do, they'll get another notification, and they'll keep coming until they act upon them. So the Vital Statistics Office then, any additional needed information will be completed by them. So any clarifications, additional information, they'll have access to the stakeholder groups that they may need to reach out to. Also, information for the date of death confirmation may be required if recorded date is incorrect. They'll receive the notification through the same interface that all the other stakeholders have. And the VSO personnel will receive the record for death registration and review its contents for completeness. They'll change the status of the record to complete, and all information then will be marked as received and accurate. And they'll change the status, like I said, and save the record. And from there, the national routing system, as we mentioned in the overall process, they pick up the channels of communication. And like we say, goal number one is to capture 90% of all deaths within 15 days and report them to the federal partners, and try to meet that goal if at all possible. So, any questions at all on that?
Susan has some question, I guess. Yes, please, Susan.
I might have missed this because I was just responding to a message as well, but where does expected death in the home or home deaths fit into this?
Well, the medical informant group, as I said, is quite large and vast. So there would be a medical informant that's involved in a MAID situation.
No, I don't mean MAID. I mean home deaths.
Home deaths. Joanne, maybe you can answer that process.
Guys,
You're muted.
Mike. Yeah, thanks. That's really where, and I understand there's already a form that's usually completed and given to the funeral homes in those cases. Is that correct,
Yes.
Susan?
Yes. So there's a process.
Yeah, and there is a process. And so we need to fine tune that with Dr. LaCure and yourself and that team to know where that will come in, because I know the funeral homes are aware of that, and that form is usually already signed and they're in possession of it, if I'm correct. And therefore, then that form can happen in a little different way than before. But we still do need the signature at some point from Dr. LaCure and their team. But we can chat about that. Okay, where we see that best fitting and at what, and we'll make notes and we'll give those to Brian. And okay.
Yes, sure. That's perfect.
Brian, did we already attach the workflows on this presentation?
No, the workflow is so big that
it's pretty broad.
It goes off the slide. But to help answer your question, we have captured that in the workflow, and I'll just share that with you right now. Let me just share my screen again. Yeah, so this is the workflow here. So it just shows that in the upper left-hand corner, the death occurs. Is the death that palliative care? Yes. The health worker notifies the funeral director to pick up the body. If no, the health worker completes the demographic portion of the death registration form. And the medical informant then receives the death notification. And of course, it goes into some details, and we would.
So that would be a different practice for us, because a health worker doesn't usually notify the funeral home. The families do.
Yes, yeah. And we somewhere down here have captured that. Yeah. Down here, the funeral director flow, if you will. They receive a phone call. It's either from medical, nursing, home, palliative care, coroner, or family member, and they initiate the transfer. Contains the information about the deceased, family, next of kin, and that's where the process would pick up in that case. So they would be notified if someone passed away at home unexpectedly, for example. A phone call would go into the funeral director, and they would be the first point of contact in that situation. And this flow is you know, it can start from the top, it can start from the bottom. There's many starting points in this flow, but it captures for each what we call swim lane. We see the medical informants across the first swim lane here, and then we move down to the coroner's office if they're involved. There's a whole list of steps for them to go through. Some of them are electronic, some of them are not. And then we're down here to the funeral directors, and then finally down to the vital statistics office and their interaction with our federal partners. So I think we have captured most instances, you know, throughout the process where it could happen, you know, at home, long-term care, palliative care, hospitals, and you know, there's one of the stakeholders in this group would be the first point of contact.
Well, before answering the other questions, well, first of all, I just want to be informed. Well, does everybody have the access to Teams channel? Are you using MS Teams? Okay. So what we are going to do is I'm going to create a specific channel naming focus group members under the EDR project, so that everybody can reach the workflows, and also we can post some information, exchange some information in this common area for everybody's communication. I will let you know when I'm going to create this. There are a couple of questions. First one is from Chanel. Is this an external new electronic system for clinicians to use, or is it connected to our existing system? Well, actually, we are still exploring this situation. The idea is not to create a direct integration with the existing health system, but we are still exploring. What we agree so far is to make an integration with the client registry. So when there is a death event happened, the demographic information will be available before making any registration. So this is the idea. But as I said, for the existing health systems, we are still investigating the situation. The other question from Eileen, should we be using expected death, unexpected death, as that is language used in legislation? Expected death? I don't get this question. Well, Joanne, do you expected death and unexpected death? What does it mean?
Expected death will refer more to Dr. LaCour and her team, because they'll have, am I correct in that we know what's happening and they're working toward that? Is that what we're referring? Unexpected as in nobody was?
It's actually more, it's more than palliative care. It's, you know, if persons are dying of cancers or those sorts of things, right? Or
Exactly,
MAID is another area where there's patients that are dying with palliative support and then may choose the end depending on their circumstances. So I'm just curious about the stream palliative care versus all the other streams.
I have a feeling this has to do with expected death rather than a coroner's inquest, Eileen. And that sort of brings to my question where I just want to make sure that this form can be filled, whether I start filling the form and then it goes to the funeral director, or if it's an expected death, the funeral director might start it first and send it to me as a physician to complete. Is that sort of how it's looks like? Because that's what it looks like in the workflow, Brian, but I'm not convinced that I'm seeing this right.
Yeah,
Yes.
yeah, that's correct. We did have quite a discussion about the all the different ways that deaths can happen and where they can happen. And I guess we've made that decision that the death occurred, and that's where the process starts. And I know there's a whole backstory as to how, where, when, expected, unexpected, and that's very important. Don't get me wrong, but the important part, I guess, as a system focus is the death occurred, and the whole backstory, although it's important, it's not. It's I can't say it's not important. It's not as important to the system, right? All the system needs is a flag that says a death occurred. And that flag sets off a whole chain reaction where the stakeholders then get involved in another capacity. So not, not the healthcare capacity that they were in prior to the death, but in a different capacity to notify the VSO that a death is being processed. And really at that point, it doesn't matter that, this person, was made, or this person was long-term care, or this person was killed on the highway.
Yeah.
It just happened, right? And now we have to start another process in the healthcare system, and that's death notification.
Jennifer?
I'm not sure if this is part of this process, but maybe it's a consideration for the focus groups. I'm just thinking about some of the work we've done recently around autopsies and the need for if an autopsy has been requested by the family. Just sort of where that I noticed early on in the process that there's a notification that goes to the funeral home. So I just wonder if there's some further discussion around the need for an autopsy, and I'm not speaking about a coroner's case. I'm just speaking for other scenarios. So that's just maybe a consideration for additional discussions if it's not already a part of your business process.
It is the medical informant, which in most cases is a physician, can decide not to sign off on the medical cause of death, and and that could be that physician feels that there's further investigation needed or requested, and until that medical cause of death is signed off, the best that we can get out of the system is an interim medical cause of death.
Yeah.
And the process can continue with that interim MCOD, but it can't be terminated until we get a signed MCOD from the physician or medical informant that's authorized to do that.
Yeah, I'm just thinking in terms of more the logistics around that, from like sort of the communications to the funeral home, and just thinking of some previous things that we've worked on. So it's just so if it's already included, that's great.
Yeah. Yeah, there is that pause. There is that pause built in where the signature is not going to be given, and that could be for various reasons. It could be that it's going to be referred to the coroner, or the physician is just not satisfied that everything is known at this point in time.
Okay, Megan.
Thank you for your presentation. Apologies if this was already addressed. I had some connectivity issues on my travels, but I just want to be sure that if there's a death that happens at home, an expected death either by a palliative care maid, for example, that there wouldn't be a delay in the funeral home coming to collect the body. Let's say it's after hours and the form hasn't been completed by the practitioner. Just a seamless transfer of the body, because obviously that would be distressing potentially for families. So I just wondered if that's been thought about. And again, apologies if you already addressed that.
We did address it, but it's always good to have clarity on it for sure. We did state right up front that the first and foremost the funeral director would be notified either through a medical informant or family member through a phone call that a death has occurred. And so this system is secondary to everything else that we see as necessary. And like you say, there's no reason for delay, and so we're not going to delay the funeral director picking up the remains just because of a step in the system. That's certainly not what we're saying. So the funeral director would carry on their normal course of business, and that is picking up the remains in a timely manner. And then, and only then, would they, worry about or even think about this electronic system.
Okay, that's great. Thank you. And is there a timeline then after the fact? Like, is there an ideal timeline that form gets completed? Let's say a death happens at home, coroner or the funeral home's notified, they collect the body. Has that been identified as sort of that ideal timeline to have the form completed?
In legislation, and I'll defer to our legislation person. I did go through it. I did read it. There is timelines. There is 48 hours. There is 24 hours mentioned, but I don't have it memorized. But we are following legislation. We're not changing it for sure. So all those timelines that are in place now are still in place.
Thank you.
But, yeah.
And just for everybody's information, these workflows are not fixed yet because the contract has not been signed. Actually, we haven't started the negotiation activities yet. So it's still actually, we still have time to make some changes. And if you have any recommendation, or if you see any enhancement areas that can be done, please just share with us so that we can implement it into the workflow.
Yes.
Hi, Brian. I really just had a question. I want to ask Jennifer and Vanessa if they can be in touch with me. I'm curious as to what policy development you already have concerning autopsy. And we don't want to lose that in the middle, right? Because I know a coroner can do that, but if there's also a request by a family member that comes from the funeral home, I want to know what development you've done. If we can talk, it doesn't have to be now, it can be later, with addressing those messages to get to the coroner's office for asking for such a thing to happen, so we don't lose that. Okay.
Sure, you can reach out anytime.
Okay, super. Thank you.
Mm-hmm. Yeah, it's a developing process for sure, and we want to share the diagram with you and make it available through the Teams channel. And as Funda mentioned, you are part of the change process, and we do want to follow this up with a survey that's related to change management. And there's a list of 15 questions in the survey, and it all has to do with the change process and the acceptance of change. And in this project here, the biggest change is going to be moving away from paper and communicating electronically. And so we want to make sure that we capture everybody's input through that survey, and we have a mechanism to gauge the level of acceptance and the degree of change that it's going to require by each stakeholder. And from there, we will be informed as to to move the process along, or to back up and not go ahead until all stakeholders are satisfied with the change. So we're relying on you to help us along the process, and your input is valuable to us, and we appreciate it.
Exactly. Yeah, we would like to implement a system which is going to be used by all the parties, not just one group of the team. So yeah, as Brian mentioned, it's very important to have your contributions and your feedback. And the survey will make us a little bit understanding your insight about this new change. And that's why we haven't actually come to you with a fixed communication and change management plan as well, because the outcome will drive us what to do. If we need to make some demo sessions, or if we need to have on-site visits, so we will understand these as well. And yeah, your feedback to this survey is also very important. Please share with us. I think we will share with you in a couple of weeks, I assume, right, Brian?
Yes, yeah.
Mm-hmm. Then yeah, we will be much more clear. And yeah, we are always flexible. Any recommendation which help the process in the government is welcoming. So please do not hesitate to share with us. We will do our best to implement the best for you. Any questions? Okay, so what I'm gonna do is, yeah, I'm going to create this channel that I mentioned to you. The name will be Focus Group. We may create some sub-channels inside of it during the life of the project. The first one will be, for example, demo, the survey, some sub-channels like that will be there. And as soon as we fix the change and communication plan, we will also upload this document in there. And this, you may ask, what is this change and communication plan? It's the framework that we are going to use during the life of the project. As you can see, yeah, we do have a big audience, actually. There are lots of involvement from different divisions, private and public. So that's why this project needs a good framework at the very beginning till the end. Yeah, we will be responsible to execute according to this plan. And yeah, we will share this plan with you as soon as we got the outcome of this survey and your feedbacks about the workflow. I think that's all. Joanne, do you want to add something? Okay, you're muted, Joanne, but I got it, I guess.
Yeah, thanks. That was great, Funda.
Okay.
Appreciate that. Thank you, Brian.
You're welcome.
Well, okay, thank you very much for everybody, for your time, for your questions, and for your continuous contribution.
Thank you
Great.
so much.
Thank you.
Thank you.
Great afternoon.
Bye-bye.
Thank you. Bye.
Bye now.
Bye.